Well, hello everyone. Welcome to our last session of Hello Health for this year. For those that don't know, I am Caroline Price, the Administrative Officer 2 with the Connected Care Program here at the Health Department. Before we get started with our last speaker of the year, just wanted to give you all a few quick housekeeping points. Any links and resources that are shared during the episode today will be on our website, cumberlandcountync.gov, as well as on your screen in front of you. If you missed the episode today, you can watch reruns of the show, Cumberland County NCTV, as well as on YouTube. Cumberland County NCTV is a 24-hour channel that does air on Spectrum Cable Channel 5, and it focuses on Cumberland County government. You can also stream CCNCTV on the Roku app, Apple TV, and Fire TV for free. So I will go ahead and let our speaker introduce herself for today.
Hello, good afternoon. I am Sanquist Graham. I'm the local public health administrator here at Cumberland County Department of Public Health, and I serve as our administrator over our substance use and social determinants of health programs, which also include our mental health programs as well for the county.
All right, so we will go ahead and get started and jump right in. So what would you say were some of the most significant public health accomplishments of this year?
I would say, so one of the things that we really looked at this year was increasing our presence in the community. And so we tried to get creative. We were doing a lot of social media reels. We were also out in our community with our different teams. So our Connected Care program that Caroline mentioned she works for, we did a ton of outreach going to community events, as well as also being guest speakers and presenters at events where we would target our non-traditional populations. We also were able to partner with those non-traditional groups to do a lot of work around just really hearing what the community had to say and what they wanted from us in public health. Also, we were able to launch a few different initiatives. We were able to strengthen some. One is our Healthy Conversations project that has been a huge success in the county. We also were able to launch overdose prevention teams in the community. And then we also have a few task forces that we have really grown and expanded on. The first one that I'll name is our perinatal task force. It took off this year, and it has been a really force in the community. We are able to sit down and really talk about perinatal needs across Cumberland County and how individuals are affected and impacted by the care that they're offered, and then also able to workshop ideas with our community partners on how we can improve those. So those are just a couple of the things that we launched this year, and we continued, and we saw a lot of growth around.
Perfect. And I'll kind of piggyback off that. Can you talk a little bit more about CFORT?
Yes, so C4 is our Cumberland Fayetteville Opioid Response Team, and we have so many initiatives that come from that task force because we have various partners across Cumberland County that serve from doing peer support to treatment to connecting to recovery services, also connecting to families who are impacted by substance use disorder. And so we really come together as a unit to look at what the community needs are, and then also being able to provide programming and staff support to reach those needs.
Perfect. So how would you say that the community has really supported the public health department's initiatives throughout this year?
I would say that we have, one of our things is we always let individuals know if we don't offer the service, we would definitely be that person that offers that warm handoff to the resource. And so what we do as a health department is we have over 36 programs here. So we try to get people covered here, but if we don't have that service available, then we try to make sure that we know a person that knows a person and we can get them to them. So throughout the year, we have just really focused on delivering quality care and then also forming really good partnerships.
I was going to say, yeah, to piggyback off that, I think partnerships are huge because, we, like you said, we do have programs here and we try to kind of address any needs that come up here, but we do want to make sure that we engage our partnerships as well. So I agree. I think that's probably a key piece to the success that we've had this year is those partnerships for sure. So in your perspective, what lessons have been learned from public health efforts of this year?
Yeah, I would say I think it still remains that we have to be resilient and we have to be willing to pivot. We've had a lot of changes this year, and with programs that we thought were going to be, long running programs, and we haven't lost them, but we've had to, create new ways of implementing services, and we've had to, I mentioned social media, become one of the time, and being able to be fun, and, also increase health literacy while making sure that we're connecting with the community. So I think just always being willing to evolve, that has been something that we've had to do.
So, speaking of all those programs, what programs will continue into the new year, and are there any new initiatives that are planned?
Yes, so we will continue our task force, so our C4 task force, we'll continue that. We have a sequential intercept mapping task force that we work on criminal justice diversion. We'll continue that. We have a teen wellness task force. We have a breastfeeding coalition. We have a variety of services that will continue into the new year, and then we'll also have subcommittees of those groups. So we'll have groups where we're working closer on specific needs, and we will continue those. We have, I would say within my division, we're looking at some crisis intervention. So we're currently hiring a crisis intervention trainer that will be able to train people across the community to look at mental health and how our partners can respond to mental health crisis in a positive way. And so that's one of the things that I see us really expanding across the county in the next year. We will also continue to look at those social determinants of health and see where we're missing individuals, where we're missing those connections. And so we'll continue to expand those programs as well.
And I'll say too, I think that talking about partnerships again, I think it's really cool because, we can also form external partnerships, right? But I think it's also important because we have so many programs here at the health department, the internal partnerships are important as well. So I think some of those continuations in the next year, I'm sure will kind of form stronger internal bonds as well.
Absolutely.
So.
That's one of the things we try to increase over and over again, is making sure that our internal teams are also collaborating, and that we're seeing where if you work in a satellite location, that you come over and that you engage with your colleagues in the building, and so what resources are available, but also who are the people that you're emailing, who are the people that you're talking to. Yep.
Awesome. So kind of going back to last year a little bit, what were some of the biggest public health challenges that we faced, and how were they addressed?
Yeah, so I will say for us, because we do try to be very transparent and share what's going on in a timely manner with both our staff and our public, I would say maybe the shift in funding across the county, we've had some changes there, and it's not necessarily to say that we've had to decrease our programming, but once again, just pivoting around, okay, how can we still work within the scope and deliver these services to our clients? Also with making sure that we have our vaccines available in timely manners to get them to our schools and get them to our senior population. And so those are things that we've had to network and navigate around.
Perfect. So kind of going back to our community again, how would you say that the community can continue to be involved with our efforts moving forward into next year?
Yeah, so I talked a lot about our task force that we have within the health department. I would say all of our task force are task force that welcome the public. We love lived experience. We love being able to hear from individuals in the community that are living out their day-to-day lives and how it's been affected living in Cumberland County. And so one of the best things you can do is get connected with our task force, the varied task force that we have. You can and they're all on our website. And so you can also keep up to date with our website, download our mobile app, and then follow us on social media because we have fun reels. We're making sure, once again, that we're increasing health literacy, that we are also reaching populations from various backgrounds. And so we want to just make sure that we're getting information out as broadly as we can to everyone.
Perfect. So what would you say moving forward are the new / ongoing priorities for the next year in public health?
I would definitely say, going back to health literacy, making sure that we're continuing that approach. A lot of times individuals don't know what they don't know. And so we are continuously providing education, awareness campaigns. We're making sure that we are translating materials for populations that need to be able to read in their native language. We're making sure that we offer translating services. We're making sure that we are also, once again, connecting with people with lived experience to be able to really assess what needs are there and not make those educated guesses on our own all the time.
Right.
We want to actually get feedback, and so I would say that's a huge part of it.
Awesome. Yeah, I was going to say, I think that's, a big piece to the coalitions and task forces is that, it's not just solely internal folks. It's not just solely outside partners. We do have, of course, folks here in the health department that sit in on those task forces and coalitions. So really those lived experiences, can kind of come in the mix, as well as the experience of the day-to-day, being able to adjust those needs. So we kind of, really try to make sure that we address those directly, and because of who we have sitting at the table, which is just super important as well. So how would you say that individuals can set health-related goals for the new year?
Yeah, so before we started filming, Caroline and I talked about the holiday season approaching and those holiday waistlines. And so just remaining active, staying active throughout the year, making sure that you make your primary care appointments. If you have missed a year or two, it's a good time to get on track with things like that. If you don't have providers, connecting with us to help you find providers. Also, getting enough rest, practicing mindfulness, and then staying current with any news information that comes out in regards to flu and COVID regulations and things like that.
Perfect. So what resources are available? I know we've kind of touched on a couple throughout our talk today, but what resources are available to help people maintain their health, throughout the holidays and even into the new year?
Yeah, so I want to shout out our health education team and our health educators that are in varied programs across the agency. We have a plethora of programs that we can offer to community groups and also with partner organizations. We can make sure that we provide meal prepping. We can help you with your menus and diet plans. We can help you with practicing those health behaviors such as getting adequate sleep and meditation and signing up for or making appointments with your primary care provider. So I think using our internal team and really looking at them as a resource would be very helpful for individuals. We have social workers that can get you connected to mental health services. And so just really trying to make sure that you are looking at yourself as a person and then evaluating what do I need or who can I talk to assess what I need.
Perfect. So, kind of we touched on this a little bit, but kind of the biggest piece of this is, how can folks in our community stay informed about issues, health issues in our county moving forward into the new year?
Yeah, so definitely follow us on social media. We have a lot of community events that we make sure we post flyers for. We get out in the community and we share those flyers with those warm handoffs of the flyers. We do them in varied areas across the community, so we're not just focusing on central locations. And then we also would say just reaching out to us, giving us a call. If you have a question about something health related, we'll definitely get you connected to the right person to get that question answered.
Perfect, perfect. Well, we appreciate you all joining us for our last session of this year, and thank you, Synquest, for being here with us today. We greatly appreciate you being here and having you here with us. So just a few quick outro points for today. Again, if you all missed the session today, please make sure that you all do visit us on YouTube and look at those reruns, take a look and see how we did. And again, after you watch, please make sure you take our survey. We want to make sure that we, kind of address any public health needs that are coming up into the new year. So if you guys have any ideas or if you guys think of anything that you want us to talk about into the new year, please make sure that you take our survey, tell us how we did, and that survey is available on our website as well. And again, any links and resources that are shared today will be posted onto our website, cumberlandcountync.gov, after our session. And again, watch those reruns if you missed our topic for the day. And again, we mentioned this last month, but we are in the last month of the year. It is the holiday season. Christmas, holidays, all the things are coming up. We want you to have fun with your family, right? Have fun with your family and friends. Make sure you eat all the good food. But make sure you get a walk in. Make sure you get some cardio in. Get a little bit of, get up and moving a little bit. We want to make sure that, we're public health. We want to make sure that you get get a healthy piece in there as well. So again, enjoy your time off, enjoy some much needed rest and relaxation. But again, make sure you get some cardio in, get a little walk or jog, and just get out and get some fresh air. And make sure you take care of your body as well. So thank you again for being here with us, St. Clair. We appreciate it. And thank you all, and we'll see you all again next year.
Thank you for having me.